Hi everyone. Today I'm going to talk a little bit about donor area. So in a donor area, when you talk about Caucasian, Asian and African, there is obviously a great difference. So here I'd like to explain what are the differences. Actually, when we do the hair transplant, when we extract the grafts, in a single graft we may have one hair that is called one single follicle unit, or two hair may call two follicle unit, or even three hairs and it's called three follicle units. Now for example, let's talk about Caucasian first. Caucasian mainly have 2 and 3 hair follicles, so that means 2 hairs or 3 hairs mainly, and that will come up to total about 220 hair per square centimeter. So that is how we calculate when it comes to Caucasian. Bearing in mind, Caucasian has very fine hair in caliber and they're light in diameter. Now we talk about Asians, where I deal a lot with Asian patients here. Asians means are the Malays, are the Chinese and the Indians. We all are known as the Asians. When you talk about Asians, our Asian hair is slightly thicker in caliber compared to the Caucasian. So our Asian hair mainly, again, when you extract, you get 2 follicle units or 3 follicle units in a single extraction. So the total come to about 170 hair per square centimeter. So now that is the Asians that we deal most of the time here. Now we also have the Africans, where I do a lot of my cases. So Africans, however, has advantages of one graft. When you take out, in that graft mostly the follicle unit is 3, mainly 3. So therefore their number of grafts is only about 160 hair per square centimeter. So they have less when you compare in the sense of the number of hairs in each races. They are slightly different, as I explained earlier. So this is important when we do harvesting. It's important to know all this as a hair restoration doctor and explain this to your patients, because nowadays I'm seeing a lot of patients because their donor is over harvest. Their donor is over harvest and they come for a repair job here. So it's important for me to make this small video for tips to how to understand and ask your doctors how to go about it. So follow me for more tips. Thank you.